guest today, my interview, is with Dr. Natalie Hammer, who is a qualified medical doctor, worked at Mater Dei for 2 years after she arrived in Malta in 2011, and then went to study in London at Queen Mary's University Hospital, where she specialized in aesthetics. Her speciality mostly is the correction of a double chin, but we're going to join her today to see what it's going to be like post-COVID, after all the patients who usually have routine procedures of Botox or fillers, whether we're going to see a stampede after lockdown is lifted. Good evening, good evening, good evening. I'm sorry, I lost you there for a while. I thought you were behind me. How are you? How are you?
Doing very well. How are you, Liz?
I'm fine, thank you. Fine, thanks. You have obviously been in lockdown also. And as I said, you're based in Malta. Before we start speaking about COVID and post-COVID, I'd like to address the importance of people who wish to have these type of procedures to have it done by somebody who is a medical doctor, medically qualified.
It is a must that you have a doctor qualified to do your treatments. It should only be carried out by an MD or a healthcare practitioner that has had the proper training. The face is such an important area where it's filled with blood vessels, nerves, muscles, different tissue layers that you really need to know what you're doing when you're handling the face, especially in aesthetic medicine.
And there are obviously side effects. There are possible side effects that somebody who's medically trained needs to know how to handle if they do happen.
Absolutely. I mean, as good as the results can be, there can also be some complications that can occur. Knowing how to handle a allergic reaction, or perhaps the filler is misplaced, or maybe even just addressing the concerns of the patient. It's really important you know how to handle any scenario and really put the patient at ease.
Yes. Now, I'd like to address people who have these procedures done on a regular basis. We've all had, obviously, a lack of our hairdressers touching up our roots, and we've lived with it. How do people who usually have regular procedures, such as Botox and fillers, how have they reacted to the lockdown due to COVID-19?
I think people have been a little bit anxious and frustrated. They are ready to have their treatments. They're looking forward to these treatments. I think that many people at home have felt a little lost in the sense of having that routine and not being able to have it carried out by their beautician or medical aesthetic practitioner. And I feel that this anxiety could also cause, some decisions of overeating. Maybe they're having more outbreaks of their face. Perhaps even the skin texture is maybe more dull, feeling a bit more dehydrated. However, there is the flip side where the staying at home has probably been a bit of a break to the person wearing makeup every day. So there are some pros and cons, but I think most of us are looking forward to getting back in and getting our treatments done.
Yes. Do you think, again, regular users of these procedures, do you think having this 2-month gap or whatever it may be has made them feel insecure?
I think it has made them really take a good look at themselves in the mirror, for sure. I think also there's a certain comfort and confidence that these treatments provide, looking good and feeling good and being able to even just socialize, and not having that in our lives right now has affected all of us in many ways. And I think we're just looking forward to taking better care. We've probably had that time at home to to maybe exercise a bit more or drink more water or maybe take time for ourselves that we haven't in the past, which is great. But I think there could be some insecurities, and I'm really looking forward to treating those patients and helping them feel better about themselves.
What would you advise people who are worried about their appearance? Because obviously we don't know exactly when lockdown measures will be lifted for these sort of procedures.
Yes, we're really hoping that these restrictions will be lifted, especially in the health and beauty industry. I know I'm looking forward to getting back and seeing so many of my clients. But if you're at home, as I always say, good skincare starts and should continue at home. Most importantly, drinking lots of water, exfoliating your skin once a week, using a good serum, moisturizer. And most importantly, now that the sun is out and we're maybe outside taking more walks, use sunblock. And please, I advise, not just on the face, but put it all over your body. I think some people have a misconception that if they use a higher SPF, that they will not be able to get a nice tan or have a glow. And that is not true. You will still get color, but most important is to protect yourself against skin cancer and unnecessary radiation.
And once these lockdown restrictions are lifted, do you envisage that you're going to have a stampede of patients who want to have these procedures again?
I feel like I'm going to have a pretty long list. I'm under the impression that the big probability is yes, people are going to be lining up for treatments. They are wanting to be pampered and looking forward to just refreshing their look. I think it'll be very much like people are talking about the hairdressers. We're all needing to just have a pick-me-up.
Yes. Can we also address first-time users who have never had any procedures before? Once we go back to the new normal that we're going to have, do you suggest that they wait a while before they start making appointments, or can they just go ahead and carry on as normal?
I think there will be some precautions taken. Number one, us as healthcare practitioners in the aesthetic medicine field will want to make sure that our patients are safe first and foremost. If you're a first-time person kind of looking at getting these treatments, I would advise that you start off with a consultation first and foremost. This needs to be carried out in a safe environment, ideally by an aesthetic practitioner. I would say I would be very hesitant just walking into any clinic that may have a waiting room full of people. You will want to, again, be aware of social distancing and just take all the necessary precautions to protect yourself.
Where does one draw the line once you start having these sort of procedures that one does not overdo it?
I think it's very important that you keep a natural appearance, that you really take time to say, is this me? Do I feel good in my skin? Most importantly, by not overdoing it, it's one thing to be a bit regimented and disciplined, but to do treatments when they're not necessary is not a good thing for you. And that is when you need to have a medical practitioner guide you. Someone who may not need a medical treatment and keep insisting on it could also have a mental disorder, perhaps a body dysmorphic disorder, and there may be some underlying issues that they're having, or perhaps it also could bring out patients that maybe obsess unnecessarily over things. For example, maybe a scar on their face that they think they're seeing and they're not. So it's really important that you go to someone who can pick up on these kind of psychological undertones and really assist and protect the patient at the same time.
And to conclude, Natalie, do you personally ever tell a patient, advise a patient, enough, we've got to stop here?
Absolutely. Sometimes it's not even starting with the patient. I may have a patient walk in and they may request a treatment that they feel like they must and most insist have. If I feel that treatment is not safe for them, it's not appropriate for them, I will not do it. And there are some instances where patients maybe want to be a little bit more over the top, if that's their look they're going for, I suggest they go to someone else. I really want my patients to look natural and feel comfortable and confident about who they are, but it's all about looking good in your skin.
Thank you very much, Natalie. Thank you, Dr. Hammer. Have a very good evening. Thank you for joining us. I was with Dr. Natalie Hammer, and we spoke about procedures, aesthetics procedures post-COVID, and what one should expect. Thank you very much for joining me. I will be with you tomorrow at an earlier time of 5:30. I wish you a very good night.